I'm going home with the rain. That's it.
Good afternoon and welcome everyone to our second listening session focused on the Medicaid changes that are currently underway. We want to hear from you this afternoon about how these changes, known as the Medicaid Unwinding, we want to know how these changes are impacting your communities. So we will devote a big part of our listening session today to hearing directly from you all. But before we get started, we invite you all to introduce yourselves in the chat. You can indicate your name, where you're tuning in from, how you learned about this listening session, what you're hoping to learn. And before we dive into talking about what the updates are related to the unwinding of Medicaid, just a couple of housekeeping items. Please mute your lines, especially if you are not speaking. We just want to make sure that we control some of the background noise, especially because this session is being recorded. We also invite any questions for you that you may have to enter them into the chat as well. And if you do want to speak, please just use the raise hand function. And I will call on you. And again, just a reminder that this listening session is being recorded. All right, so just a bit of a refresher. I realize some of you may not have had a chance to tune into our first listening session earlier this year. We held it in April. And we focused it on, what exactly was going to be happening over the next course of the year related to Medicaid. And I am just remembering, I did not introduce myself at the beginning of this call. I dove right in and I apologize. My name is Melissa Williams and I am the Director of Grassroots Advocacy and Partnerships for National Patient Advocate Foundation. I may be a familiar face to many of you. So hello again to those of you who have participated on a webinar or a listening session previously. If you have not, welcome. We're very excited to get to know you and to hear from you, hopefully this afternoon. All right, so going back here to what's currently happening with Medicaid. So some of you may remember President Biden acknowledged earlier this year that the COVID-19 public health emergency would be expiring. And with that expiration, a special program designed to keep people on Medicaid ended as well. This program was referred to as the continuous coverage. And some of you may remember that during the COVID-19 pandemic, states were given extra funding to keep their Medicaid rolls open, and a lot of them had taken advantage of this. But starting on April 1st, states can now disenroll people from Medicaid program and from the Medicaid program and resume normal operations. We know that this change, this shift, has a really just dire consequences to many of people. Millions of children and adults who still qualify for the program may be disenrolled during this process, therefore losing their insurance and likely worsening their health outcomes. So moving forward, and I'm just going to ask again if you all can please mute your lines just so that we don't have that background noise. Thank you. All right, so the main reason we're really focused on this, as well as a lot of other patient advocacy and community advocacy organizations are focused on this is because a lot of these Medicaid enrollees will get disenrolled for procedural reasons. This means that they may still be eligible, but because they did not check their mail or sent in the appropriate paperwork to stay on the Medicaid roll, they would lose their coverage. And so I'm going to show you a little bit of data that we have well, not NPAF specifically, but what we're going to show here today is public data that is available that shows just what the impact has been related to these disenrollments. And so this map here is from Georgetown University's Health Policy Institute, specifically the Center for Children and Families. This map showcases when states would begin disenrolling beneficiaries from the Medicaid program. A lot of those disenrollments began in June with 22 states deploying that at that time. There's still a couple of states now with this month that have begun that process. And I think Oregon is the last state that will join this process in October. So about half of the country, or more than half of the country, are now within this unwinding process. And what we're seeing, initial numbers here reported from the Kaiser Family Foundation, or KFF, as they are currently now known, indicates that over 1 million people, 1,652,000 Medicaid enrollees have been disenrolled in 28 states and DC. And this is using data that is publicly available. And this was as of July 5th. You'll note that the largest number where we are seeing these disenrollments are in Florida. And so I know we have some advocates today here from Florida. So we would really appreciate hearing from you about what the experiences have been regarding people who were on Medicaid, maybe losing that coverage. If you're a navigator, what that experience has been like, we really want to hear from you. But that said, there are disenrollments across the board or across the states. And this number here shows, or this figure here shows that as predicted, 74% of the disenrollments are due to procedural reasons. And you can see this just sort of across the board again, that that continues to be the main reason why people are being disenrolled from the Medicaid program currently. And something else that we had pointed out in our first listening session is what the impact could be on children. As of the numbers right now that are being reported from 6 states, children account for roughly 1/3 of Medicaid disenrollments, and that's as of this date. And again, this is only from 6 states. The numbers that are coming in are across the board because the reporting has just been a bit uneven at the moment. Hopefully we'll know more numbers soon. But these were specifically some of the things that we wanted to point out to you. And all of this is available on kff.org on their Unwinding tracker. And so those were largely the updates, again, that we really wanted to focus on. But we really want to use the bulk of this hour and a half that we have together to hear directly from you about what you all are seeing, what you all are hearing related to the Medicaid unwinding process. But before we dive into opening the floor up, I'm going just to launch a poll here to hear a little bit or see exactly who we have here joining us today. And so I'm just going to launch this poll. And if you guys can just take just a couple seconds to respond, we really want to just get a snapshot of who our audience here is today. So the first question is related to how you identify. You can select any of the options that most aptly describe your role. It can be patient, caregiver, patient advocate, navigator, or community health worker, healthcare professional, or other. And the second question there is select the region you reside, and you should only select one. Are you all able to see the poll? Let me see.
Melissa, I just responded. This is Brittany. I saw it on my end.
You saw it on your end? Okay. All right. So I think, let's see, it's indicate. I'm not seeing anyone responding. Let me see if I can try one more time.
Melissa, I have the results.
Oh, are you seeing it?
Yes.
Okay, great.
I can, I think, let me end the poll, then you all let me know in the chat if you're able to see the numbers. Let me actually take a photo in case. Okay.
Thank you, Mary.
Of course. Is everyone able to see the results?
Mary, I'm not able to see it. Do you mind saying it
Oh.
out loud?
Yes, of course. Sorry. So the first question was asking how you identify. The top response, of course, is a combination of patient advocate, navigator, community health worker. And the second highest identification was a healthcare professional, and a close third, 30% identified as patient. And a majority of people on this call, 53%, are in the South, 23% in the Northeast, 17% in the West, and 7% Midwest.
Thank you so much. That helps me. Thank you, to get a sense of where you all are joining us from. So now we really want to open the floor up and hear from you all about what you are seeing, what you are experiencing. I see that many of you are navigators. And so specifically in your role as a navigator, what challenges are you experiencing as we are going through this unwinding process? So with that, I will leave this slide up just to leave it as a prompt for people to respond to the questions. But at this time, I will stop talking and open the floor up to see who would like to share regarding your experiences. Brittany, please go ahead.
Hi, everyone. I'm happy to be here. I've missed this community so much. For those of you that don't know me, my name's Brittany. I'm in Tallahassee, Florida, and I am a navigator. So I am not aware of any impacts on patients or patients getting denied care. I have a couple friends that work in the health arena that are healthcare professionals, and I will be reaching out to them to find out more information on what's going on. But I work more on the legislative side of things. Specifically, I work in education policy, but my husband works for the legislature. And I called him earlier today, and he kind of like reassured my my belief on this last session. Medicaid was not a priority, a legislative priority for Florida. It was really, they passed a bunch of education bills. I believe 10 specifically were passed. And there was no expansion to Medicaid in Florida. I know our governor is not really focused so much on addressing Medicaid at this point. I know he's running for president, and he's got a lot of other priorities in the forefront of his mind. However, I did see an article this morning that Florida has become the front runner for states heavily impacted by inflation. And I really feel like that will play a role into this topic. So I'm curious to see, I'm curious to talk to my healthcare professional friends, but that was not a priority of this last legislative session, and they wrapped that up in May. And they will go into committee week starting September. So my husband works for a representative. She does sit on a couple healthcare committees, and he knows this is something that I'm involved in. And so he will definitely be keeping that in mind when he goes into these next committee weeks. But that's all I got. Thanks for listening to my report.
Thank you, Brittany. Anyone else like to chime in about what they are experiencing?
This is Jackie from Montgomery, Alabama. And I wanted to know, has anybody else seen more fraud or more scams than related to your insurance, Medicare, Medicaid? Now, actually, the more impoverished areas are being targeted here in Alabama, in that they call you and they just really shout at you and tell you that your insurance company didn't pay and that you are now responsible for this bill. I was one of those people that got one of the phone calls, but it was already handled and this person was still trying to collect money. Just wanted to know if anybody else experienced that.
A great question, Jackie, and thank you for raising it. And I will repeat it here. It looks like more scams related to insurance-related scams, health insurance-related scams that patients are getting, where people are asking or people are being targeted for, it looks like paying a bill. Is that right, Jackie? Being on the hook for a bill.
Right, yes, the bill has already been taken care of, and they still call you and shout at you and tell you that this bill has not been paid by your insurance, and now you are responsible for it. They are very intimidating.
Has anyone else experienced that or have heard stories around that?
I'd be curious who it was that's actually calling.
Well, in my case, it was actually a physician's office. About some kind of way, they did not send the bill to Medicare on time, and therefore they were out of the time frame to be paid. And so they decided, or she decided, that she was going to target me and make me pay it.
Interesting. I'm not seeing anyone else have had that experience here. I think, oh, Rebecca, please go ahead.
I don't have a response specific to that, but I do know as well that there are different versions of health credit cards happening now, and different loan efforts. Really strong outreach that physicians and others are sort of being attracted to because it prevents them from having to become that collection agency. And there's a great deal of worry behind that because these sorts of credit cards, if you will, can force care to be more costly. People think they're getting a good deal by using a credit card that will help them with their out-of-pocket expenses. But in fact, they have higher interest rates and can prevent people from getting financial assistance and other things they need. So one corollary issue that people should just be aware of, and it's not related to the Medicaid unwinding, but it's related to this larger challenge of others trying very badly to get paid every penny, even if it's not due, of trying to scam people with different stuff that seems too good to be true, like short-term insurance plans that don't have adequate coverage. There are so many different ways people can fall into a hole of thinking they have the right sort of coverage. And then when it doesn't get submitted properly, and that would have been the physician's office's fault in this case of the Medicare challenge, it's really hard to fight back on those. So in the context of this Medicaid unwinding, to sort of turn us back to that key issue, I'll say first to Brittany, have a look at the data in Florida, because I'm so grateful and glad to hear as a navigator, you're not hearing about challenges, but Florida's caseload of disenrollment, procedural disenrollment, is pretty staggeringly high and concerning. So even though you're not experiencing it anecdotally right now in your work, it is happening in the state. So that KFF website and the information about the data in Florida would be relevant for you and your husband to have a peek at, and for everybody just to be thinking about, with all these different communications happening, whether it's an aggressive phone call that we just heard about asking for payment, or mailing, people will tend to just tune out, understandably, because it's just too much and it's distressing and overwhelming. But when they're not paying attention to notices like the Medicaid re-enrollment notice that tells them their due date and the needs that they have to do that, and they're tuning that out too, we have a bigger problem, because then they're going to lose their coverage unnecessarily. So all of this feeds into the challenge of information overload and clutter that's happening. And how do we cut through it to make sure that folks that need to know about their re-enrollment requirements are paying attention to those notices and responding to them, or getting the help they need to find out the due date and the opportunities, which is something I know Melissa and Mary have spent some time putting together the tools for you all to help support that work.
Rebecca, I think we're losing you. Sounds like you got like, I think she cut out, but I think she was able to deliver the gist of her message as it relates to our discussion at hand regarding the unwinding and the information overload that people might be experiencing, and not really understanding what is real information, genuine, authentic information versus, the junk mail. And I think as advocates, it's our role specifically to help people understand what are the things that they should not miss. That mail from Medicaid is not junk mail. And I know that can get pretty difficult for people to kind of parse through because of life. And I'm seeing some comments in the chat. I know, Francis, you are also in Florida and are sharing some information here regarding sort of what you've been experiencing. I'm not sure if you have an opportunity to chime in more over audio. If not, that's okay. And Tammy, I think you had indicated that you've experienced some of what Jackie was talking about as well. And I understand that you're also in Florida. So I don't know if you have it, if you're in a place where you can unmute and maybe share a little bit more about your experience.
Yes, I'm in Florida. My son was on Medicaid, and we never received a letter in the mail. And they kept calling, and they were saying that he was disenrolled, and we need to fill out a form, but we still haven't received anything in reference to the Medicaid information. Nothing at all.
It's interesting.
And so, and then I talked with several other people, and they said they didn't receive a letter either, and their Medicaid was, they were disenrolled. So they weren't able to get their medications. They weren't able to go to the doctor, because I have a friend that has a disabled daughter too, and she wasn't able to go to the doctor or get her meds or anything either, because she didn't receive a letter. She didn't get anything in the mail.
So are you able to share a little bit more about what when people aren't able to get their medications or go to their doctors, what are they doing to overcome the situation that they're in? Are they able to get a hold of anyone at the local Medicaid office or any other navigator that might be able to support?
I think they've been calling, but some of them have been going to like the health department, or like with my son, he has to go to the centers. So if not, I have to pay out of pocket for his medications, whatever the cost is. And some people can't afford it.
Right.
I think they have a place called Brothers Keeper here, or Interfaith, where you have to go and fill out a form, and if you can verify or prove that you don't have enough money to pay for your meds. Sometimes they'll help with some of it, but it just depends on what the medicine is and how much it costs. So some people are just going without, they're not able to get their medications, or they're not able to be seen by their doctor right now because they don't have Medicaid. They disenroll.
Oh. Thank you so much, Tammy, for sharing what you're experiencing and what others are experiencing. I think that's very much what we've been fearing would be the outcome, that people would lose their coverage, not know about it, and then therefore not have access to the medications, doctors, treatments that they need. Are you aware, Tammy, if some of the people that you've been connecting with, are they familiar of, where to, I know you had mentioned some of the local organizations that could provide help, but has there been any sort of disconnect among the general public in terms of, or Medicaid beneficiaries, of who they need to contact or where they should go? Do you know if people are struggling to find that information out?
I think some of them are, and some of them are not computer, don't know how to work the computer or the phone. So and then some of them don't have the case numbers or the passwords to get in, to check their information. And then a lot of them don't know who to trust, to try to go to help them with, their information, to get recertified or go back in to see if they disenroll or they mailed a letter out to them, and, it doesn't have the correct address on it and all that kind of stuff.
Tammy, thank you so much for sharing your experiences. I think this is exactly the kind of information we are wanting to capture about what the impact, what the outcomes are of this, this change in Medicaid policy, what it means for patients. So thank you so much for sharing. Would anyone else like to share your experiences? I know we've been sort of zeroing in on Florida because we see with numbers that is right now incredibly alarming in terms of the disenrollment rates. But how are other states managing this information? I saw we had someone from Nevada who works with Nevada Health Link, Tanya Rojas. I was wondering if you have encountered any disenrollments. Are you in a position where you help people re-enroll? If you're able to unmute, would love to hear more about what you are experiencing in Nevada.
Yes. Hi, everyone. Can you hear me?
Yes, we can hear
Okay.
you.
Okay, perfect. Yeah, we're getting some clients that they're being losing Medicaid. The issue that we're being having is that they're getting letters from Medicaid, not because they're not eligible for Medicaid based on excess of income, but because they didn't return the documents that they were supposed to return. So when they receive the documents, like you're not eligible for Medicaid no more, they tell them that with that letter will be enough for us to enroll them in a plan. But that's not the case, because the letter has to say that they are denial because they're excess of income to qualify for Medicaid. So we had to send them back to the welfare office, and then they have to not reapply, because if they reapply, they won't be able to enroll, because they won't have a qualified life change event that it's losing the insurance, because they're going to be applying outside the open enrollment. So they had to go back and try to get a different letter from them. So I'm been getting clients with that situation.
Wow. Wow. Thank you so much for sharing, Tanya.
Yeah, you're welcome.
I appreciate you unmuting and sharing that experience. I also am seeing we have another navigator. Looks like Michelle calling in from West Virginia from the ACS National Navigation Roundtable. I'm not sure if you're in a position where you might be hearing some of these experiences from people directly in West Virginia who have been impacted by these Medicaid changes. It looks like she may not be in a position where she can speak over audio. But I'm curious, are there any other navigators in other parts of the country who may want to chime in with an experience maybe similar to what Tanya shared about what you're seeing or experiencing related to these disenrollments, and if there is anything that might be that might make your job easier?
Hello, everybody. My name is Cynthia. Can you hear me?
Yes, we can hear you, Cynthia.
Okay, I'm a Nevada Health Link enrollment counselor, and I work for Medicare assistance program as well. As Tanya mentioned, we are getting a lot of calls in regards to people losing coverage. We're doing a lot of outreach with medical providers, mainly because people find out that they don't have coverage when they go to the doctors. I heard a lot of people just losing coverage, and we have helped a lot of people on Medicare where they had Medicaid and they just dropped them. They don't get access to doctors or medication. So if anyone here has that experience, I will recommend to find agencies, nonprofits to help you and guide you to access resources. Unfortunately, we can contact them and help them find other ways to get cared, but unfortunately, people that just losing Medicaid, they are leaving them without not many options, and it's extremely sad, mainly for adults, seniors, that they don't have many options. So there are organizations in every state that they help, as we do. So contact them, get a counselor to help you, because it's getting to a point that is very concerning, mainly because there's people, they have very concerning health issues and they cannot be without care. So keep an eye on your mail, any kind of notices, because that's mainly what's happening, that they're missing the time frame for them to enroll or send any kind of documents, and they ended up with nothing, no coverage. So that's just something that I would recommend. Just make sure that you find an agency that could help you. It's very hard to navigate this by yourself. It's always good to have a case manager, a social worker, anyone that can guide you through it. It is a lot of information, so I will highly recommend that. It's to help you navigate this whole process.
Thank you. Thank you so much. And it was Cynthia, is that right?
Correct.
Yes. Okay. Thank you so much for sharing your experiences. And I was wondering, Cynthia, if you if it weren't for these nonprofits or these other community organizations that can kind of step in to help during this situation, where else could you turn for the help?
Well, a lot of the calls that we get, mainly for Medicare, is people that Medicaid has our contact information. So Medicaid, when they don't want to, or they can't help them, they send them to us for us to contact or just help them with resources. So they can always call Medicaid or Medicare, but I have the experience where they can just pass the ball to each other. And that's very frustrating for anyone that is kind of in the middle. A lot of people get frustrated, and I hear it when, if you ended up with no coverage and you have health issues, that's something that you don't want to be in that situation. So I'm sure every state has, for Medicare beneficiaries, every state has an agency that helps them. For Nevada is the Medicare Assistance Program, but every state has something similar to that.
Thank you. Thank you again, Cynthia. Are there other navigators or even just community advocates who might want to chime in about what you are seeing, experiencing in your communities? Okay, hearing none right now. I just want to ask either Rebecca Kirch or Becky Schiff if you could perhaps remind us what sort of measures are in place in case these disenrollments get out of hand, or if there is anything that within CMS that they can do that can help prevent this loss of coverage. I think maybe that policy reminder could be helpful, and why we're so interested and focused on hearing some of these experiences and stories, because we can elevate them to CMS, and there are measures that they can take that can prevent some of these disenrollments from happening even further.
So thank you, Melissa, and thank you, everybody. This is Becky Schiff. I'm a policy consultant for MPAF. So I do think it's important to lift up that, what is happening now is a return to current law before the pandemic. As we've discussed in past sessions, states have the right to provide these, enrollment procedures to ensure eligibility for, people eligible for Medicaid. So it is not a new thing, but it may feel, for some of the clients and some of the patients, it may feel new. But so I do think as we approach this, we acknowledge that this is not necessarily a new thing. It may feel new, but it's actually a return to current law. There are, somebody mentioned Florida. There is a lot of, ways to be active on the state and local level. That's where the rubber hits the road. That's where you should be starting. There are a number of organizations that are tracking this. I believe Melissa has made those resources available. Kaiser Family Programs, Georgetown Center for Children. There are a lot of entities that are tracking this. They, we make policy on what we measure. So it's important that you make sure that these organizations in your states know the numbers and know your stories. There is a provision that the president laid out when he announced that we would be returning to current law, that if the situation became too disruptive and it wasn't quantifiable, so it's, it wasn't like if it hits this certain number, but if Secretary Becerra, Secretary of Health and Human Services, determines that the situation is causing undue stress, it's getting out of hand, there is kind of a break glass in case of emergency provision. I think we're a little too early in the process for that to be a viable option, but that underscores the importance of, keeping track and making the case, if that needs to happen, why it should happen. Does that help, Melissa?
It does help. Thank you so much, Becky.
And I'm happy to answer any federally based questions. Melissa is our grassroots guru, and I support her in terms of being a resource on federal policy. So I'm happy to support Melissa if there's any federal questions people have.
Thank you so much, Becky. I appreciate it very, very much. I wanna let me see here. I think there is a comment in the chat from Lori from Montana. She has shared that the facility has been impacted because Medicaid turns their passport provider authorization back on, requiring us to reach out to the primary care provider the patient has signed up with for approval to come to or continue care with the cancer center. A lot of mixed messages about what the authorization number will cover, will or will it not cost cover the different department within the cancer center. Rolled out the last minute since it's been turned off for several years due to COVID. Patients no longer have the same primary care. And it looks like the results has been patients who have lost their coverage often have not received a new card or insurance. So struggling to ensure we have an authorization with a new coverage. Lori, would you be willing to come off mute and share a little bit more, like just what that experience has been, both for patients and healthcare providers? It looks like she may not be in a position to come off mute, but appreciate you chiming in there in the chat. Thank you. I see your note there, Lori. Thank you so much. All right. I just want to do a last call to see if there are any other comments or questions related to this unwinding that you all have before we turn it over to some of the resources that we've been referring to and making sure that you have access to those. All right. And let me see, Jay, I see your note here. I'm wondering if you might come off mute to maybe say a little bit more regarding the confusion.
Yeah.
I think, yeah, go ahead.
I'm hearing a bunch of things that, at least from my experience, don't make a whole lot of sense the way they're being presented. I know if you are dropped off of, at least in my state, if you're dropped off of Medicaid, you have a window, an open enrollment window for, ACA, Marketplace, Obamacare, call it whatever you want. And as part of that process in the system as it was set up in this state, you're automatically effectively doing the data entry for a Medicaid application. And if you're found Medicaid eligible, the ACA application is suspended and it's referred back for a determination on the Medicaid. But there is a window of opportunity within which you have to do that, in order to go through the process. And I forget whether it's 45 days or 60 days, but if you exceed that window, you lose eligibility for the ACA enrollment. And at least in my state, the program, the ACA programs are not as comprehensive and rich as Medicaid is, but it's, you're much more likely to find providers and you're much more likely to get care under the ACA program than you are under the Medicaid program. And if your income is low enough and you're appropriately advised, it's essentially free coverage. The second piece of the puzzle is if you work for an employer that's offering some certain of the most common kinds of ACA subsidies, even if you would otherwise be Medicaid eligible, the fact that that subsidy is available from your employer can make you Medicaid ineligible. So it's a very, very complicated, interrelationship. And one of the big problems that I have with the way the program is administered, at least here, is if you actually have the experience set to know enough to understand the insurance programs, the state probably doesn't want you as a navigator. The flip side is if you are doing the ACA enrollments as a commercial insurance provider, the state is so heavily burdening you that most of the commercial insurance agents that I know of are refusing to do the ACA business because it is a time sink and money loser for them. So it's kind of a catch-22, and the system, at least as it's in place here, is incredibly complicated. And the starting point is people, get hung up in the interplay between the various programs. And, particularly if you are, low income, but not destitute, 65 plus, it is just mind-bogglingly complex here.
So Joe, this is Becky Ship, the policy consultant. I'll jump in here with just I've got a reaction to you, but I've also got a point of personal privilege. I cracked up when you said that the ACA coverage, while not as expansive a benefit package as Medicaid, was actually probably more effective. You might be happy to know that view is shared by the Federal Congressional Budget Office. I was actually a part of the discussions that led up to the ACA, and when the Congressional Budget Office evaluated those two programs, anything that directed people away from Medicaid into the ACA, into the exchange was more expensive. So they also share your view that it may not be as a robust a benefit package, but your chances of finding a provider are better. So you should feel validated at least, or CBO should feel validated. But
Well,
to your
that varies tremendously from state to state.
and that's to my second point, which is, what I am hearing personally is that there is a serious hodgepodge of what states are trying to do. Like, I know, excuse me, in California, they've got a state funded program that if people aren't eligible for Medicaid, they're trying to get them into the state funded program. I know that there are some states for kids, if kids are not eligible, they're trying to get them into CHIP. I think one of the things, and maybe Melissa, we talk internally about a next listening session to do a deeper dive into this. And Joe, hopefully we could maybe use you as a resource for that, just kind of the various other plates in the air as states are trying to manage this.
As in most things with healthcare, since the government got involved, it's all about the money. And at least as it applies to Medicaid here, it's very much, we're trying to extend coverage, but we really don't want to spend any money. The flip side of that is on the ACA side, the reimbursements to providers are such that you can actually get providers, but you have deductibles and copays and a variety of things that unless you can afford very substantial premiums, it's kind of crazy. And if you're not eligible for some of the subsidies, I just had a conversation with somebody today, the unsubsidized family premium for a 60-year-old in this state right now is over $3,000 a month.
Which is out of range for a lot of seniors, completely out of range. Yeah.
It's out of range for a large percentage of the population.
No. Wait, remind me, what state are you from, Joe?
I'm in New Jersey.
New Jersey. I thought they had a fairly robust Medicaid program up in New Jersey, but
well, they have a fairly robust program in terms of eligibility.
Okay.
But the payment to primary care providers is so low that no economically driven primary care provider will participate. The reimbursement for home health care is such that it's so low that it's almost impossible to get home health care. The reimbursement for nursing homes is so low that the nursing homes are financially not viable and horrific compared to the comparable facilities 10 miles away in a different state. It kind of manifests its way all the way through the system. And it's not new. It's not the result of the pandemic. It's not the last 5 years. It's kind of how the system has been set up. The flip side is the ACA side is very, very heavily subsidized here. There's state subsidies on top of the federal subsidies. So pretty much at some fairly substantial incomes, you can effectively get free healthcare coverage better than most solidly employed people in the private sector could ever dream of affording for free. But you still have you have the ACA paradox that the ACA created healthcare that by definition, to be affordable, is going to have large deductibles, large copays, and that was foreseeable by everybody who understood the system at the time, except, apparently the politicians who, didn't understand basic economics and thought they could rewrite the rules of basic economics. And at least here, there is a very large, working population that is uninsured for just those reasons.
All right, Jay, thank you so much for sharing some of what you're experiencing in New Jersey, even as it relates to just Medicaid, ACA, sort of enrollment and challenges there, even beyond this unwinding discussion. Really appreciate it. I know we're at the top of the hour. I believe we go till 6:30. I don't think we'll take the full time, but I do want to share some of the resources that we've been referring to through the beginning and kind of I guess throughout the listening session that could be helpful for you in some of the actions and activities that we would like for you to take part in to help make the work of both navigators easier, to make sure patients don't fall through the cracks and end up losing their coverage, as some of the stories we've heard. And so we have created a toolkit, and we're going to drop the link to the chat that we want you to take a look at. We've outlined 3 activities that we think will be very easy for you to do from your home, or if you want to, take a step to go above and beyond, going into your communities to lend that helping hand and help steer people to where they need to go. But one of the first activities we are asking for you all to take part in is gathering some insights and stories from people who have been impacted by the ending of the continuous coverage benefit that was in place because of the public health emergency, and provisions that were in place because of some of laws that were passed during the COVID-19 pandemic. We have a resource where you can go to drop in links to articles, to just even type in stories. Tammy, I'm thinking of you and what you shared in some of your experiences. We have a way for you to add that information to a spreadsheet that we've created. And that can help us kind of collate all of the information that's out there that we might not be able to see because we're not in your communities, but you can help lift up these stories so that we can elevate those stories even further. And so Mary, whenever you have a chance, if you can drop the link to both the spreadsheet and to our toolkit, just so that people have a chance to take a look. Secondly, we ask that if you feel comfortable using social media, spread the word about these changes that are taking place in Medicaid and what the impact has been on people. Educate your networks about what is happening. We have directed you in our toolkit to some places where you can go to drop in images, drop in just social media copy that you can just add onto your platforms and help just spread the word. I think Cynthia had noted it very well regarding what we need to do to help spread the word about what these changes mean. And you'll see on the lower box there, the lower left box, just the most important messages to share related to these changes within the Medicaid unwinding process. And we know many of you like to just go out and help people one-on-one. And so we encourage you to do that as well. So you can just lend a helping hand, go to doctors' offices, go to food banks or public libraries, get a sense of who has been impacted by this. If there are questions about where they need to go, what forms they need to complete, our toolkit indicates just where you can get that information. So we try to make it as easy as possible. But most importantly, we want you to share what you're learning with us, and you can use that spreadsheet that's linked there to fill it in with what you're seeing, where you live, any notes, anything that you want us to come away with. We're going to keep coming back to that spreadsheet just to get a sense of what are the stories that are happening, or what are the stories that we're seeing, that you're seeing in your communities, and what is it that we need to do from where we are here at NPAF to help make it easier for either you all as advocates, or maybe shine a light on some of these issues for policymakers to take a closer look at. So that's really all we have today, but we really wanted to just, again, thank you all for taking the time to listen in, share your experiences with us. If for whatever reason you weren't able to chime in, you're welcome to email me directly about what you are experiencing regarding the unwinding process. Also send feedback regarding our toolkit. The toolkit that we've posted, you'll see, is a Google Doc. It is a live document that we can update at any time. So please keep coming back to it for some changes, and we'll try to alert you all to if there are changes that that have been done, so you all can take a closer look. So I am dropping my email in the chat. Please contact me if there's anything else that that is top of mind related to this topic of the unwinding of Medicaid, anything that we can do to further support you all where you live. And I'll leave it with that. Thank you all again so much for your time this afternoon. We hope you have a good rest of the week.